right. Hi students, welcome to week 2. You all did such a great job the first week. I loved getting to know all of you guys a little bit better on the discussion boards. Really interesting backgrounds that you guys have. I hope you all had a chance to sort of read each other's introductions to themselves. I'm almost done putting the sheet together where you guys can exchange cell phone numbers and things like that. I was waiting to hear from a couple people, but I'm just gonna assume maybe they don't want their numbers out there, so that's fine. So I'll put that together and I'll post that on our Blackboard site. I'll put it under like where the syllabus is. I'll put it in the file with the syllabus, so you guys can go there and get each other's cell phone numbers for those of you that want to exchange numbers with each other. So I was really impressed with last week. You guys all completed the health assessment, which I hope gave you an idea, just a beginning idea of, I hate that, like your own health beliefs, where you stand from a health standpoint. I am a firm believer that healthcare providers need to be role models. I think to say to somebody, do what I say and not as I do, is very ineffective. So I believe as healthcare providers, we should be leading the charge in healthy behaviors. We should not be smoking. There should never be a healthcare provider that is also a smoker. If you are a smoker, you need to quit. That is just awful. In addition, I think healthcare providers need to be eating healthy. They need to be working out. We need to be role models, because how can you say to your patients, you need to work out, a diet, exercise, if you're not doing that yourself? Sorry about the dog in the background. I'm babysitting my son who is in college. I'm babysitting his dog. So, okay, so this week you are going to read chapters 3 and 4 in your textbook. These I think are pretty interesting. I make sure that you read these because they really provide a solid foundation for what is theory. Now, if this is your first introduction to a theory course, it's really important to understand what is theory. Basically, theory is the underpinnings of why you believe what you believe. And there's all kinds of theories. There's middle range theories, there's grand theories. A theory is basically a way of looking at a phenomenon of interest. It's sort of a set of constructs. And there can be multiple different theories surrounding one phenomenon of interest. You know, all kinds of things. I'll go back to my smoking example, is that, back in the day, the theory was smoking was sexy and it was healthy and it was promoted. And so the theory was tobacco was good for you. Cigarettes are good for you. Cigarettes promotes social interaction. It's, that was the theory. Well, the theories have changed now. Now the theory is it's not as good. There's other kinds of theories, and I'm going to draw from nursing. I think most of you guys are PAs in the course, but since I'm a nurse, I'm going to draw from what I know. So, like for example, we might look at the phenomenon of caring for sick people. There's a nursing theorist, Sister Callista Roy, has developed an adaptation theory. Her theory is that people adapt to health and wellness. There's another one, Jean Watson came up with one called the theory of caring, and that she says that nurses help people heal because they provide care and that people want care. There's another theorist, Madeline Leininger, came up with the transcultural theory, where she said that that care needs to be based on the culture that a patient is in. So there's all kinds of ways to look at a particular phenomenon. So the ones that we're going to talk about this week are in chapters 3 and 4 of your textbook. And we're looking at what are the roots of the behavior? What is, and looking at these roots of behavior, we're going to look at it through the lens of social behavior theory. What tends to drive an entire society to behave in a certain way? And then in chapter 4, we're going to look at the individual health behavior theories. And so in chapter 3, it looks at like society as a whole and health behaviors as a whole. And then in chapter 4, we're looking at how do you in particular, why do you do what you do in relationships to your health and health belief. So I want you to read chapters 3 and 4. They're not terribly long, and I think they're kind of interesting. It gives a pretty good historical perspective. In the week 2 folder in our Blackboard site, there are PowerPoints to go along with those if you would prefer to do the PowerPoints and in addition to while you're reading. There's some more information on some other kinds of theories that aren't well presented in the book, like planned behavior, reasoned action. There's a couple more things in here, some examples of health belief models, some articles. One is on cardiac rehab and one is on the use of helmets. So read those to try to get an idea of how are people presenting theories and how are they presenting these health belief models. So then you've got 2 assignments this week. You've got a discussion board this week where you're going to think of a time that you've made a healthy behavior change. You started eating more vegetables, you started working out, you got more sleep, you quit smoking, you were drinking less alcohol, whatever your healthy behavior is. I want you to think about that, apply it to one of the models that we talked about from this week, the health belief model, the theory, plan, behavior, whatever. And how does the model fit with your healthy behavior change? I want you to start linking those two and really thinking from a personal standpoint, what was the theory behind that led your health behavior change? And then you need to not only post yours, but also respond to other students. So that's an assignment. And then your second assignment is that you are going to write your first application and reflection. So it's like a paper and it's worth 100 points. So in the Blackboard site, there's the rubric for what we're looking for. There's five different components to it. I want you to kind of think about what health behavior you're going to target in this course. Which health behavior theory is going to explain your target health belief. And explain your behavior using the components of the theory. So you need to be pretty familiar with the theory that you're purporting so that you can start explaining your health behavior behind that. Describe the plan and how are you going to evaluate the change. So one thing that I do a lot in my practice, I work as a care manager in a internal medicine physician office for the clinical side of what I do. And one thing that I do is I meet with patients all the time, all day, every day, and we talk about what are your healthcare goals? And I ask the patients, what is your goal? And I have people say, I want to lose 12 pounds in a year. I have people say, I want to lose 80 pounds in a year. I want to quit smoking. I want to exercise more. So I have the patients state what is your goal. How are we going to measure that goal? Okay, if you weigh 200 pounds right now and you want to be, in a year from now, you want to be 150, that's the goal. That's a measurable goal. And so then we can break that down at, month 3, you want to lose X amount or whatever. And so it has to be something that you can measure. It can't just be vague like I want to feel better. Okay, how are we going to measure that? You got to be able to be specific about how you're going to measure something. So then, this computer is annoying. In number 4, how is your current behavior influenced by the susceptibility to a negative outcome? So spend some time thinking about that. So like how much of the behavior change that you're doing is influenced by, having like a negative outcome. For example, let's say that your goal is to lose weight. And so, yes, you know, we want to do a 50-pound weight loss just to improve health and things. But how much of that might be you want to lose weight because you don't want to be diabetic, or you are afraid of heart disease or something like that, or you're afraid of what people think. So you got to think about some of those aspects as well when you're thinking about your own theory and your own motivation for health behavior changing. And then explain the role of self-efficacy, meaning the role of like motivation and knowledge about the disorder. Because what I find in my own practice is that a lot of people aren't really aware of their eating choices, their sedentary lifestyle. They're not aware of the association between those behaviors and hyperlipidemia, hypercholesterolemia, diabetes, all these things that they're not making the association. So anyways, so take some time to look at that. It does have to be an APA formatting, so hopefully you learned that from last week. You guys all uploaded your APA resources, so that was good. So those are your 2 assignments. One is the discussion board and one is the application paper this week. So I would start reading these this weekend and then start it on those 2 assignments. As always, if you have any questions or need me, you guys have my number. A lot of you guys have been texting and emailing. That's awesome. I'm always here for you guys. So that's it. This should be a good week. I look forward to continuing to work with you guys, and holler if you need me. Okay, we'll see you guys soon.